Okay, good morning. Um, my name is Barbara Lopez. I'm the director of Make the Road Connecticut. Make the Road Connecticut is a statewide organization that fights for the power of immigrant and Latinx communities because we believe that we deserve to live with dignity and respect. We do this by organizing, we do this by providing legal and survival services, we do this by transformative education, and we do this by ensuring that we are able to do some policy innovation. And usually, pre-COVID-19, we would see our Hartford office buzzing with our members, getting together and strategizing about how to change systems that are not designed for themselves or designed for their young children or a family in general. So today is a somber day. Many of our members are not here, not only because they want to protect their health, but also they cannot afford to get sick by this pandemic, by COVID-19, on top of everything else that they have going on. It's been 2.5 months since our community members, our undocumented and mixed status families that have gone without no paycheck, have gone with no help, unemployment insurance, no monetary support at all. 2.5 months of thinking about should they pay bills, should they buy food, or should they buy medicine. I just want you to understand the impact of not having any income and no support when this government, this country tells us that because you have no status, you have no humanity. So I want you to understand to put yourself in the shoes of people who have nothing, not because they don't deserve it, but because this country does not see their humanity. So we hear these stories every day, and we are working on the ground to figure out how we can organize to change these things. But today, our members and our undocumented family, our undocumented mixed status communities are in our minds and in our hearts. And we want to remember that we want to move from a narrative of scarcity to a narrative of abundance, especially in a state like Connecticut, where we're very, very wealthy, where we hold a lot of billionaires, and also where our community, our undocumented and mixed status community, contributes to this local and state economy about $124 million. So I want you to keep that in mind. However, because we've been hearing all these things happening on the ground, we are pleased that we are able to be part of a bigger partnership that wants to address these challenges that our community faces on a day-to-day basis. And this partnership is a public and private partnership. And I'm going to have speakers that are going to talk more deeply about what this partnership means. I am pleased to introduce Governor Lamont, Housing Commissioner Mascara Bruno, and our other allies who have been really leading on this charge, and of course our leader that will really just shed light of what this actually means for us. So thank you for being here.
Hello, good morning everyone. My name is Veronica Ubaldo. I am from Mexico, and my family and I, we've been living in Connecticut for over 25 years. We call this state our home. This is where my daughters were born and raised, and this is where we wanted to stay. I became a member of Make the Road Connecticut over 2 years ago because I knew by firsthand the struggles the immigrant community face. I want to use my voice to demand changes so people won't have to go through the same thing that I went through when my family were separated by ICE. On top of the struggles we live every day, my community was excluded by the government during this pandemic. People who contribute to this country every day, they were left out in the most tragic time. Many of the family members, friends, community have lost their jobs. They don't have money to pay the rent. They don't have money to pay their bills. They can't get health care if they need it. I don't think this is right. We deserve more. We have been demanding the state to provide a relief to our most vulnerable, and today we're here to announce the first phase of the relief that was provided by the state, $2.5 million in rental assistance. We thank you, Governor Lamont, Commissioner Mosqueda, and others for the first step to the hustle to get this money to our communities now, because it has been months without any help. And even though it's 2.5 millions, it's not enough. The current proposal of 2.5 millions is only one-time payment of $1,000 to 2,500 families only. We ask Governor Lamont to fulfill his responsibility to our immigrant communities in Connecticut and commit to continue to work to ensure the phase 2 of the relief, that it could help us to get more money to our community members. We believe that phase 2 will be a minimum of 30 to 150 millions. At Make the Road, we are committed to work alongside our allies, Governor Lamont, Commissioner Mosquera Bruno, and others, to ensure the phase 2, because we will still feel the impact of the pandemic. We're still going to have it for the next few years. Thank you.
Good morning. Is there any Spanish-speaking press here? ¿Hay prensa de habla hispana? ¿Quiere que diga algo en español? ¿O más? Okay. Buenos días. Good morning. My name is Kika Matos. I work at the Vera Institute of Justice. I am a New Haven resident, and I'm a longtime advocate of immigrant rights in New Haven, in Connecticut, and around the nation. As the governor might remember, just 6 days ago, I was one of the group of advocates, supporters, and families that was circling the Capitol in a car caravan and rallying the governor to urge him to set up an economic relief fund for the undocumented. Today, it gives me great joy to be here celebrating the launch of a public-private partnership that will focus on supporting undocumented immigrant families in our state. Undocumented immigrants are very much a part of our community. There is an estimated 120,000 undocumented immigrants in our state, and they pay on average $125 million every year in state and local taxes. While some of us have had the luxury of working from home under this pandemic, unfortunately that has not been the case for far too many undocumented immigrants. They have been on the front lines of this pandemic. What have they been doing? They have been taking care of our sick. They have been taking care of our elderly. They have been looking after our kids. They have been cleaning our hospitals. They have been working in our factories, and they have been cooking our food. Some have gotten the pandemic and have had no means of support or relief. Others have died. And still, they've been denied any source of funding from the federal government, and until today, very little support from the state. So today, I want to thank Governor Lamont and this amazing organization that was recently stood up, 4CT, for stepping up with this initial investment of $3.5 million. It is a good start, but let me just be clear, it is not enough. The need is great, and families are desperate. So I urge, and Governor, I'm going to continue to push you, and you, Ted, as well, to make sure that the state, that the legislators and the governor work aggressively to continue to grow this pot of money. Governor, let's please make sure that every single undocumented immigrant family in this state get the love and the support that they both need and deserve. Thank you.
Thank you, Kika. I'm Ted Yang. I'm the co-founder and CEO of 4CT. Since our launch 2 months ago, 4CT has provided more than $10 million in aid through grants and directed donations to those most in need in our state. We are proud to stand here today with our partners to announce the creation of the 4CT card. The 4CT card is a novel solution designed to help those most affected by the COVID-19 crisis by providing direct aid to the families in need. 4CT is donating $1 million to the ineligible, undocumented population that we're all here today to support through this 4CT debit card. We are partnering together with community-based organizations and community health centers to distribute these cards to those most in need in an accountable and equitable manner. I'm asking today for partners to join us in this very important endeavor. You can do so by lending a helping hand to your fellow Connecticut citizens. As our state reopens, some of us may be ready to go back to eat at our favorite restaurants, and I'd certainly encourage everyone to do that. But others of us in this state still do not have enough food for their families and do not know where their next meal is coming from, thanks to this horrible COVID disease. I ask every single one of you listening to me today to come visit us at 4-ct.org. That's our website, 4-ct.org, and donate to this very important initiative. Thank you. Yeah.
Good morning. Thank you, Ted, Kika, Governor. Good morning, everybody. I'm Cela Mosquera Bruno, the Housing Commissioner, and more than ever today, I'm thankful for the Governor to have me as the Commissioner of Housing because it gives me the opportunity to help my brothers and sisters. I am also an immigrant. I came here about 32 years ago. Don't get my age. And I did not know the language, so I had to work. I worked 2 jobs, and I know for a fact what some of our brothers and sisters are going through because my parents were undocumented when they first came. So I'm here to say that the Governor, the OPM, and the administration as a whole do care. And thank you, Kika, for raising your voice and for reminding us that this group of people are important. It's about 4.9% of our workforce. And we do need them. We do like to go to restaurants. We do like to go to hotels. And they provide a very important work for our state. As the Housing Commissioner, my job is making sure that people have a place to live. And more than ever today, as this health issue has raised, we need to have people in place. Regardless of status, we need to have people to have a place to stay. We don't have enough shelters, and shelters is not the best place because of the epidemic. We don't have a vaccine, so we have to work together. So I'm here to tell you that I will be working together with the grassroots organizations to make sure that the resources that we have are going to be deployed in the best way we can. So thank you.
Well, good morning, and Make the Road, thank you for hosting us here. I love that name. Everybody else follows the road. I like Make the Road. I appreciate what that means. Cela, I mean, this is a really important program. I want to get everybody back to work. As Cela mentioned, the immigrant undocumented represent 4.9% of our workers in the state. A lower percentage of our population, which means you're much more likely to be working in the state and paying taxes and providing for a family and getting our economy going. If in this undocumented category, it's fascinating to me. And one of the things we wanted to do with the housing is make sure that we could provide a grant to landlords. It's $1,000 for folks who are having a hard time being able to pay their rent. It's hard to get back to work if you don't have a roof over your head. And that was an absolute requirement. And Kika, you, and my daughter Emily, I might say, have been reminding me how important every day, this is to make sure that this is a population that doesn't get any federal benefits. This is the population that pays taxes and is otherwise being left behind despite their amazing contributions to our state and our economy. And that's why this is important to me. And Ted, I love 4CT. 4-ct.org. They've already contributed philanthropic dollars, amazing people from Connecticut contributing, over $10 million invested so far. Avestastor Food Share and Food Bank, and helping to create a pipeline between our farmers and folks in need when it comes to food. And this is 4CT thinking again creatively in terms of this $1 million grant, and the Health Foundation and others are going to be providing money alongside of it right now. What does it mean? It means we're going to have a 4-CT card preloaded with some cash on it for you to help you get through these next tough couple of months. Maybe you pick that up at one of our federally qualified health centers. While you're there, you meet a doctor. While you're there, we'll tell you you can get tested. While you're there, we can tell you can get tested at absolutely no cost to you and no questions asked about documentation status. And while you're tested, if you're tested positive, we can do two things. A, let you know that there is no cost for treatment. And also track and trace so we can find out who else you've been in contact with, who in your family, who in your community, so you could be safe as well. These are the type of partnerships that I think are so important, starting with amazing not-for-profits like Make the Road, working with state government and housing, and working with 4CT, making a difference for people who make a difference for our state every day. Thank you, everybody.
Governor, what is your message to taxpayers, Keith McGilvery from Fox 61, about the enormous amount of money that has had to be spent to facilitate and execute all of these resources and initiatives to kind of support Connecticut during this pandemic?
You're asking about the $3 to $4 trillion that the federal government has put out over the last 6 weeks? Is that the question?
Largely either state or federal money that's gone in to support initiatives.
Look, I get nervous as heck when I see the federal government pushing out that much money that quickly. That said, given the nature of the pandemic, given the fact that the economy was virtually shut down, given the impact it has on families, like the families we're talking about here today, I think it was the right thing to do. And I think we got to get money to small business, as we've been talking about, so they can power through till the economy really opens up, and give money to folks that otherwise wouldn't have the opportunity. I need it here. We're going to be spending well over $100 million in testing. We can't put all that on the backs of our Connecticut taxpayers, so I appreciate the help we've gotten from Washington.
Governor, how will this money be distributed in addition to what you said about health clinics? Obviously, this is a population that, unlike the other benefits, there's no registry. There's no way to equitably distribute this. So can you give us a little better idea about outreach, or if anybody else wants to chime in?
Yeah, I'll get others to chime in, but I hope it's groups like Make the Road that explain to the population who they're working with every day. Can I just finish off 1 second? They finish off every day. They reach out into the community. Let them know this is a program that is available to them. Make sure they know how they can get their 4-CT card. And also give them incentive to find a primary care provider. Sorry, Mika.
No, that's okay. So I can speak to I can speak to the 4CT details. 4CT has partnered with health clinics around the state, and they've also partnered with grassroots immigrant rights organizations that have reached into the immigrant communities. And so the idea is that these community-based organizations work with families in need, undocumented families in need. They know them, they know who they are. They would be the ones who would identify the families in need, and then they would fill out what we're calling a prescription, which is a form that goes to the clinics, to the health clinics, with information about the family that they will send. They then send that form to the clinic, and then they send families to those clinics. So I'll give you an example. If it's in New Haven, for example, Unidad Latina en Acción would fill out that prescription, would send it to the Fairhaven Health Clinic, then they would direct the family to the Fairhaven Health Clinic. Once the family goes to the Fairhaven Health Clinic, there will be clinicians who will offer COVID testing, who will offer other health services, and then that family then goes to the person who's assigned at the Fairhaven Health Clinic, who will then give them debit cards, and the debit cards are in denominations of $200 or $400. But it's really up to the grassroots organization to determine the allocation, the amount that the family is due, based on things like the size of the family, how they've been impacted by the COVID, and whether they have any other form of support. And for the housing piece, I'll turn it over to Selah.
Very briefly, because we're still working on details, but we will be working with 5 or 6 organizations, grassroots organizations. It's a coalition that I started a conversation with them yesterday. So we know that we want to do up to $1,000 for rents, working with the landlords. The money will be directly going to the landlords, but we will be working and following the lead of the grassroots organizations to select the families.
Governor, there was mention of a second phase at a considerable increase in cost. I don't know if you're part of that. I mean, is there a phase 2 on the table in discussion?
We'll see. Obviously, we're still figuring out what we're going to get from the federal government. They've got their second supplemental. You see what came through the House, waiting to see what we get through the Senate. I think, unfortunately, that may not be decided in June. That may be decided a little later, but we have to figure that out within the overall context of our budget.
I can't imagine the federal government is going to commit emergency funding to be used to support, at least as it is presently constituted now, to support undocumented purchase and consumption without immigration stuff.
That's true, but what we see, what we get from the federal government gives us an idea of what we can do at the state level as well.
The states also in a bind, as you have pointed out a number of times. Apparently, a change in timing of the Medicaid reimbursement payment that's sort of reduced the deficit that we're looking at, but it's still more than $600 million. We're still looking at close to $2 billion next year. So can the state of Connecticut afford to spend money on this population?
Well, we're talking about $2.3 million to provide rental help to landlords who are taking care of folks who otherwise might lose the roof over their head. Similar programs that we provide for our general population in need as well. In addition, Paul, we're working here with 4CT and philanthropic dollars, not tax dollars, to do a better job of making sure that these folks have a little bit of cash to take care of basic needs and have an incentive to get a doctor and get tested. I think it's a good investment by the state.
Governor Lamont, you talked a lot about helping and not getting enough money from the federal government. Are you looking very closely at the budget and saying, where can we put money and our resources towards these places that need help?
Yeah, that's just what we do. That's what we do.
How does it impact you? How does the budget stand now?
Right now, look, we've gotten hit. Income tax and sales tax revenues collapsed in the last 90 days. The good news for Connecticut is we kept much more of our economy going than our neighboring states, so we have not been hit as hard. And secondly, we do have a rainy day fund, and let's say this is a rainy day. Raining germs, but it's a rainy day. That said, we're going to be very careful in terms of how we backfill the budget between now and June 30. And make sure we have a budget in place that allows us to power through until we get on the backside of this COVID-related recession. I hope that's by the end of this calendar year, but time will tell.
Governor, speak to the protests and what we've seen over the course of the last week in Connecticut. As a parent, perhaps, what would you say to kids who see this? A lot of kids are home from school, they're young. We see people lying down in the middle of the highway, tens of thousands of people out and about. What is a child to take away from that?
A, don't lie down in the middle of a highway. B, these are people protesting for an idea much bigger than themselves. It's called justice. It's called accountability. This is what America was about. That is the American dream. It's an imperfect dream, but every day we try and be a little bit better. And I've been really proud of Connecticut. I've been proud of the way our law enforcement has worked sometimes arm in arm with the protesters. At one in terms of the goals they want to achieve. Sometimes how we want to protest, we got to make sure we keep the peace. And I think our state police and our protesters working together have kept the peace in a way that's the envy around the rest of the country.
Governor, a couple of our neighboring states now have deployed their National Guards. Are you anywhere closer to doing that or still holding off there?
No closer to doing that.
When does 4CT, are these cards already rolling out, or when do we have an idea when this will begin? And I just want to make clear, is it all philanthropic money, dollars, donations?
Yeah, go ahead, Ted.
Thank you.
Hi, yeah. So we are just starting this program. We have not started yet to deploy the cards. We expect that to happen in the next couple of weeks through the mechanism that Kika outlined. Just want to say one other thing about this population that we're looking to help here. We like to use the word ineligible because there are American citizens that are, because of the CARES Act, because they are married to or are children of undocumented residents who have not received funds. So these are taxpayers, these are the children of taxpayers, these are the husbands and wives of taxpayers, and these are a lot of your essential workers. So we are absolutely proud to be helping that group, and you know that's absolutely a thing that private philanthropy can jump in here and make an impact, and we're happy to do that, and obviously need more help to do more.
And that gets all covered by donations?
Yeah, that's right. So 4CT as an organization, we are independently sponsored in terms of our own costs. So we pass 100% of this on. Now, obviously, there are some costs here in terms of the debit cards and some of the other pieces here. But 4CT does not take anything out of this. We are independently funded for our costs. So we're passing 100% on.
Is there any concern that by giving out these cards mostly to undocumented people, that the cards could label people as undocumented in a way that could potentially cause trouble for them? No?
Yeah.
They're just debit cards. If you get, what you get is a debit card.
Add something. I want to add something. This is Barbara again. So we are appreciative of the private-public partnership, but I want to highlight that our undocumented and mixed status families have always worked to raise their voice and have always come together to be together in solidarity and to help one another. And I want to highlight that the work of fundraising has fallen upon the community, and there is already movement to support amongst the community, individuals who are stepping up to support these folks. So there is UndocuFund, who was a collaborative, a group of people coming together because they saw the need and because they understood that this country was not seeing the humanity of the people, and they're raising over $75,000, almost $100,000 of grassroots fundraising that when they opened up in 10 minutes, it closed down. So the need is there. There's groups like Semilla Collective. There's the groups like the Bridgeport Mutual Aid and New Haven Mutual Aid and Waterbury Mutual Aid who are coming together to fundraise to help these communities. So I think we should stop talking about oh, what's gonna happen with what people are already coming together, and there shouldn't be the responsibility of individuals. It should be the responsibility of the government to really look out for the people who make and who live and who make this state very special, but also who are adding to the culture of it. So I just want to highlight that the work is already happening, and we need to highlight and respect and acknowledge that these folks are already doing the work, and who unfortunately are not here today, but they are leading on the work. And if people who are watching want to contribute to UndocuFund, the Semilla Collective, all the mutual aids, Make the Real Connecticut, we already launched our own relief fund, you also can do that. So I just want to highlight that that is already happening, and it's nothing new, it's been happening. So I just wanted to make sure that you all knew.
For the folks from Make the Road, so you mentioned that you wish the state would do even more. What, in addition, you wish the state would do to help the community?
I think this is a great first step because, like you all heard from my peers, from our leader Veronica, it's been months, right? It's been months without anything. So we need support now. So this is a great first step, and we want a commitment from Governor Lamont to continue a second step to see how we can get more resources, because like Veronica mentioned, this is a great first step, but it's not enough. And we have already seen firsthand that this will go very quickly. So we want to see a commitment to work for a second step.
Does the executive orders concerning evictions and that and the sort of renter protection, that applies to all renters regardless of immigration status, correct?
Yeah, that applies to all renters regardless of immigration status. Thank you, everybody.